Hey guys, welcome back to Scanning the Mind. Today we're doing one more of our medical journeys and I've managed to track down an oncologist. So Taha, you're an oncology reg. What stage of training are you at?
So I'm at ST4 level. Oncology is split into two.
Okay.
There is Med-Onc and Clin-Onc. I'm a clinical oncology reg. That means I would have finished medical school, 5 years. F1, F2, I did the academic foundation in
Smart
Manchester.
guy.
So my mum says. Then I did my CMT. That was in London. Then came back up here and started doing the academic clinical fellowship.
Oh, nice. Okay. Oh, so are you an academic oncology trainee?
Yeah.
Oh, impressive. So just going back to the beginning, whereabouts did you go to medical school?
So this is in Manchester.
How did you find it?
Manchester's a good uni. The only thing I would say though is because it is near to the Christie, that's probably how or why I got into oncology.
So tell me, what do you like about your job? What are the advantages of being an oncologist?
Oncology is one of those specialities which is a bit niche and a little bit out there. So it probably doesn't come to everyone straight away. But the thing I love about oncology the most is the fact that the science is by far the most interesting part of medicine. It's a sort of medical science that changes every few years. So I started medical school in 2010, a long time ago now.
That's the same year as me, mate.
But back then, malignant melanoma was basically a death sentence.
Okay.
Lung cancer had basically 2 treatments. Most of oncology then is very different to how it is now. I don't think any other speciality of medicine you can compare it, the level of development, the way that it innovates itself. And cancer research is, the most heavily funded of all the research subspecialties. And that's just from the chemotherapy side of things, the way that the checkpoint inhibition has managed to turn that malignant melanoma into a chronic disease, or the way that, now that you have like 20 different lines of treatment for a patient that would have only had 2, it changes every so often. It makes it a bit more tricky because you have to keep up with quite a lot, but that's the interesting bit about it.
Sure.
The thing also about oncology, aside from like the science side of things, the patients are the best part by far. Oncology patients, I can say hand on heart, are better than pretty much anywhere else I've been in medicine. The staff in oncology are generally really, really good. The quality of nursing is exceptional. And I know this stuff shouldn't really matter, but it's part of the reason why you come to work every day. If I'm on the wards and there's someone who's sick or there's someone in outpatients that people are worried about, everyone wants to help and everyone wants to do that best for that patient. There isn't really anyone that turns and wants to do oncology just to sort of get by. No. Basically. And there's something about the patients, you'll have a few, difficult patients as you get with any specialty. But oncology patients, they're generally the most down to earth, the most nice patients of all. And you think about it, my job in clinical oncology, so it's either, curative, so, neoadjuvant, adjuvant patients, or, directly curative patients. Okay. So you're giving them treatment that's going to cure them of cancer. So that's a difficult time in anyone's life, obviously. But they're always just so grateful for what you're offering them and what you're doing for them. There's something about it that, I don't think I'd find anywhere else in medicine. And if it's not curative and it's, palliative, which is unfortunately like a large part of our job, you're giving someone a few extra months of life that they wouldn't have had, more time to spend with their family, more time to, I've got so many patients that have like bucket lists, they want to do stuff, travel the world, see things that they wouldn't have done, because, without getting too philosophical, everyone, ends up dying at some point. Yeah, sure. It's just cancer reminds people of it, that they've got less time. It brings out a certain side of patients that you probably don't necessarily always see. And, I've always found that that sort of working life is something that gives me a great bit of job satisfaction, which I wouldn't have got if I did anything else. I can say hand on heart, like I feel like my job makes a difference to patients every single day. Whether it's something really minor in terms of like helping someone understand or get through their treatment, or whether it's something really big, like I had a clinic every week where I see patients who finished chemoradiotherapy for the head and neck cancer, nasty type of disease, but it's very curable. Okay. So you're taking young patients, 30s, 40s through chemoradiotherapy, really hard 6 weeks of treatments. And you're seeing them and giving them the all clear results. Like every week you're just discharging patients after you've given them some grueling treatments. The joy, the tears that come from it, the fact that it's like someone can see the future again after they've seen you. I don't think I'd ever get that in anything else in medicine. And that's from the curative side of things. I know you've got the palliative side. It's really sad in some ways, but you can also give a lot of people a lot of things to look forward to, help them through a very difficult time. So Taha, you've told us all the amazing things about oncology. Are there any downsides to your job? I think there's the obvious one that, you're dealing with cancer every day. So it's really emotionally charged. You're going to see stuff that will make you very upset, to say the least. Okay. Stuff that's, emotionally really, really touching. I can remember all the difficult cases of, sad patients, of people who've progressed on treatments, people who've died on treatments. I can tell you about, the sad case of a 40-year-old lady with metastatic breast cancer who came to us, with new brain mets, went off on the ward, and the saddest part of it was they'd kept the diagnosis from the kids. and suddenly out of nowhere, these kids are being brought into a cancer hospital for the first time, and they're seeing their mum in a coma from a brain disease, and she died within 48 hours. And the hardest part of it was telling the kids that their mum had cancer, and not only she had cancer, she was going to die from the cancer in a day's time. It's dark stuff like that, that will, it will imprint itself on you. It does become quite a lot.
Okay.
And there's an emotional aspect to it, and it's not for everyone for that reason. I can tell you all the good reasons why it's, something that gives me motivation to get up in the morning and I feel like I'm making a difference in patients' lives. But then the counter to it is always when it doesn't go the right way.
Sure.
But I suppose aside from that, it is a difficult job, trying to keep up with everything.
With all the developments and everything like that.
Yeah, cancer science changes so quickly. There's new drugs, there's new radiotherapy techniques. It's a field that evolves itself every 5 years. So you need to stay on top of it to keep up with it. And I suppose, maybe more from clinical oncology, there are exams to it, and that which might not be for everyone.
Fine, fair enough. What's a normal week like for you?
I mean, the good thing about oncology is it's an outpatient job.
Okay.
So, you're not slumming it on the wards like you did back in the...
So people don't know, working on the wards, inpatient work, is stereotypically thought to be more grueling, would you say?
It's life on the streets. You don't want to do it.
I was trying to be PC about to be it is life on the streets sometimes, I agree.
Yeah, because most of your job, like 80+% of your job is outpatient based, most of your job is going to be clinics.
Okay.
So I work in a big cancer hospital, so we still have inpatients. So you still go around and see them every day, but because there's a bit of a shift and a way of changing your expectation of what you're doing, because it's all outpatient based as well, then you're having to deal with a lot of the queries from patients having chemotherapy, radiotherapy, reviewing them on site. So you'll have also a few radiotherapy clinics.
Okay.
When you're in clinical oncology, patients are having treatments, chemotherapy clinics to see how patients are getting on with their treatments. You'll probably have 1 or 2 MDTs a week where you talk about difficult cases or people going through treatments. Because we do a lot of radiotherapy treatments, you have to plan it as well. Okay. So we got a lot of protected time to build up like proper radiotherapy plans, which can be really simple to a single beam, to something super complicated like a big massive complicated head and neck proton plan, with 15 different treatment layers, that sort of thing. And then on top of that, it's just admin. So it's a pretty good job plan.
It sounds, with it being mostly outpatient, that you can control your workload to a certain extent. Yeah. Is it one of those where most of the time you finish on time?
I mean, I can't speak for everyone, but most days I finish at 5.
When you were in med school, did you know you wanted to be an oncologist, or when did you decide that?
I don't think I really knew what I wanted to do. I think I wanted to do neurology. The funny story of it was, when I tried to get some work experience, my dad said, I'll get you some work experience in neurology. He misheard neurology and got me urology instead.
Oh, right, okay. Easy mistake to make.
I went to med school, kept it quite broad. And then it's a bit lame, but I remember it was like second year of med school and we were doing like a case on cancer. I left it too late. I started doing some reading at like 11 p.m. I opened up Robin's pathology and I don't know what it was. I started reading and before I knew it was like 7 a.m. and I just read the entire chapter through and I was like, this is amazing. Okay. This is what I want to do for now, forever. So then I got a bit more experience into it, spent a bit more time with like fellowships and like, taster weeks, that sort of thing.
And this is while you were in medical school?
Yeah. So I think I knew pretty early on I wanted to do oncology.
Oh, that's nice. That's really good. I assume if you know what you want to do early on, you can kind of tailor your CV to that. Whereas some people, including myself, I didn't really know what I wanted to do. But
I would say and qualify with that. Not everyone knows what they want to do. And in oncology, a lot of people decide quite late on. So quite often happens is people want to do something like, I don't know, like something a bit more gen med or acute medicine, and they get really disillusioned with it. Yeah. They spend a bit of time in an oncology hospital. They quite like the way things are set up. They quite like the patient-doctor interactions and the science behind it, and they want to switch. And they're pretty late on by this point. They've got applications in like 12 months' time. Quite a few people do manage to pull that together.
It's not one of these specialties where you need to know very early on. Yeah. Because things like ophthalmology sometimes strike me as you need to know pretty early on that you want to do it, otherwise you're not going to get in. Yeah, like ophthalmology, neurosurgery, that sort of thing, unless you've put yourself on the path like years ago, you don't really stand as good of a chance. Whereas oncology, you can make that switch later on from what you're saying. Yeah. That's good, okay, that's really good.
And I think for people who want to get into oncology, the first steps would probably be trying to set up a fellowship or a taster week or getting a rotation in some form of oncology. Try and get some exposure in clinics, trying to set up a project in something to do with oncology. And it doesn't need to necessarily be in a cancer centre. It can be something like in a GP or a hospital setting to do with cancer itself. And these are things that will look good on your application. Bearing in mind, there aren't that many cancer centres across the country. So pick the one that works best for you and has the things that you're sort of looking for. But for instance, some certain centres might not have things like protons, some centres might not have a big clinical trials portfolio, that sort of thing. So it's just about knowing beforehand when you're applying what you're looking for.
Okay. Well, thank you very much for coming on, Taha. You've certainly enlightened me about the world of oncology and hopefully convinced a few people to do oncology. Thanks for watching, guys. If you liked the video, hit the like button and comment down below and subscribe to our channel. Apart from all that, we will see you guys same place, same time next week, STM Sundays, without Taha. Come on if you want again.
I mean, you'll get your director instead.
Yeah, his brother's sat behind the camera shy. Say hi for the camera, lads. See you guys later.